Have you ever heard of a surgery with a 300% mortality rate?
It sounds impossible, right?
Like something out of a horror movie.
But this actually happened, and the man behind the scalpel was one of the most famous surgeons of his time, Robert Liston. Welcome back to our channel. Today, we are diving into the bizarre and brutal world of 19th century medicine to uncover the story of the fastest knife in the West End. In the 1840s, surgery was a terrifying prospect.
There was no anesthesia, so patients were wide awake, feeling every single cut.
There was also no understanding of germs, so surgeons rarely washed their hands or their instruments. Infections were rampant and often fatal.
In this grim reality, a surgeon's most valuable skill was speed.
The faster they could operate, the less time the patient had to endure unimaginable pain and the lower the risk of them dying from shock on the table.
And nobody was faster than Robert Liston. This Scottish surgeon was a giant of a man, standing at 6'2", and he was renowned for his lightning-fast procedures. He could amputate a leg in under 3 minutes, sometimes in as little as 28 seconds.
Spectators would crowd into the operating theatre, stopwatches in hand, to witness his incredible speed.
He was the rock star of the surgical world. Patients would specifically ask for him, knowing that with Liston, their suffering would at least be brief.
But speed has its own dangers.
Liston was known for his somewhat cavalier attitude.
He would often hold the bloody knife between his teeth while he used his hands to tie off arteries.
His operating coat was famously stiff with dried blood and gore from previous operations, a gruesome badge of honor in those days.
This brings us to his most infamous case, the only surgery in recorded history with a 300% mortality rate.
The patient needed a leg amputation. As usual, Liston went to work with breathtaking speed.
In his haste, while sawing through the bone, his knife also sliced through the fingers of his young assistant, who was holding the patient's leg steady.
As if that wasn't dramatic enough, while swinging his blade back, he accidentally slashed the coattails of an elderly spectator who was watching the procedure a little too closely.
The spectator, believing he had been stabbed in a vital organ, instantly collapsed and died from a heart attack, right there in the operating theatre.
So, what about the other two?
Well, the patient whose leg was amputated later died of gangrene, a common outcome at the time.
And tragically, Liston's young assistant, whose fingers had been cut, also died of gangrene a few days later. Both their wounds became infected, likely from the same unsterilized instruments.
One procedure, 3 deaths.
A 300% mortality rate.
It's a shocking story, but it highlights just how far medicine has come.
Robert Liston, despite this incredible failure, was actually a pioneer.
He was one of the first surgeons in Britain to perform an operation using modern anesthesia.